I'm happy to be here. I'm really excited to talk about what I do at Marian Polke Food Share because I love what I do. It's amazing work, and it's work that leaves me feeling like there is hope and there is a lot of wonderful things happening in our community, and it's a pleasure to be a part of it. And it's a pleasure to stand in for Rick today. If there's one thing to take from that, carry your GPS when you go out in backcountry. But luckily he's doing fine, and that worked out for him well. So that kind of saved him, and he's at home and healthy, but had a little accident. So happy to step in and excited to talk to you all today. Okay, so I like to tell folks what I'm going to talk about before I start talking. So here's what you're going to hear today. We're going to talk about who is Marian Polke Food Share, who are we as an organization here in Salem serving the two counties, Marian and Polke. We're going to talk about what is food banking, an intro to food banking itself. We'll talk about community needs in the area. What are we responding to? Why do we exist as an organization? Then we'll get a little drive more detail into what are the programs that we run, what do we do. I'm sure many are familiar with food distribution programs, with food drives, that sort of thing, but there's a pretty big picture of all the different things that we do, so we'll go into more detail there. Then we'll talk about some of the changes in food banking. How have things changed over the last several decades? What are the trends that we're seeing? And then specifically, how is Marian Polke Food Share changing? What are we doing to try to respond to the unique needs that we see and be a part of the longer term solutions to hunger? As Anne mentioned in my introduction, very wonderful introduction. Thank you, Anne. That was very nice. I've been with the Food Share for coming on 8 years now, about 7 years, and worked for a few other nonprofits before that, and had a real strong interest I developed an interest in food while I was living in Arizona. I saw this sort of intersection that food has across cultures, across all income levels, and that it is a tool for community building. That people can really all relate. Everybody loves to eat, everybody needs to eat, and food struck me as a really unique and important joining point for people across all kinds of walks of life, and an amazing tool for change in the community. So I worked for a few programs that were more on the social service side, and then a few programs more on like gardening and farming programs, and then got to really bring those together here at the Food Share. And so it's been a wonderful 7 years, and I'm excited to tell you more about what we've been doing. Okay, so we'll start with just some basics. Who is Marian Polke Food Share? We're a community-based nonprofit organization. We're, of course, based here in Salem, Oregon. We serve two counties, Marian and Polke. So while our location is here, we, especially over the last several years, have really intended to be a nonprofit that serves the communities of Marian and Polke counties. So we are here to serve Dallas. We're here to serve Staten. We're here to serve Woodburn, Almsville, Hubbard. I mean, every little, and paying more attention to all those communities, as well as Salem, of course, where we are located. So we're established in 1987. When I get into the history a little bit, we'll kind of that's the time period that most food banks formally became nonprofits in the 1980s. We'll talk about why that is and how it developed that way. Again, we're a nonprofit organization. That means we have a volunteer board of directors from local community members that guide and oversee the organization. We have an amazing board of very involved community members that support what we do. We're our organizational size. We have about 50 employees. We have several different departments. One of the things that I'll mention now that I was asked to mention was what are kind of some of the different roles within the organization, and some of that will kind of just become apparent as I talk about the programs. You'll know we have staff in each of those programs. So the bulk of our staff are oriented towards mission delivery. We manage a warehouse, so we have folks that work in the warehouse. We have drivers that are delivering food. We have people whose job it is to bring food into the organization, food resourcing, work with donors, we'll get more into that later. We have volunteer managers, where we have a huge number of volunteers at our organization. We are massively dependent and love to work with volunteers. I would imagine many of you have probably been to the food share and volunteered yourself or seen volunteers working. So we have volunteer managers. We also have a staff of people who do our fundraising and communications, about 12 staff that are involved on that side. And then there's everybody running the programs day to day. And so that's people who are going out working with food pantries and meal sites, Meals on Wheels. Again, we'll get to the programs, but that's just kind of a rough picture of our staff. We have myself and one other vice president who leads our fundraising and communications efforts. And then we have several program managers around each program, and then a whole bunch of frontline staff doing the work every day. I also included our mission statement, leading the fight to end hunger in Marian and Polk counties. That's our mission for our organization, and we base everything we do around that. So, food banking. So we're going to take a step back and think about what is this business, this activity that Marian Polk Food Share does, and that is done across the country. The United States has really a national network of food banks. There's a larger organization called Feeding America that helps to support food banks all across the United States. And it's an amazing network, both in Oregon and across the country. When we think about the history of food banking, there's a few different things that come to mind. Of course, people addressing food, the need for food's been happening forever. As long as there has been want, as long as there has been poverty, there have been people that, of course, give food to those that are in need. So that's a long tradition that it could take a long time to talk about. But a couple of the touch points, I mean, we can think of the Great Depression and soup lines and that sort of thing. So that's all part of the legacy of food banking. The first kind of more formal USDA distribution program where the government was giving out food really came specifically through tribal programs, working with Native Americans where there is a real lack of food on reservations. So some of the models started with that. Where the modern food bank started is quite recently, though. In the 1980s in particular, there was generally a reduction in support for food stamp programs and a continual kind of increase in the need in low-income communities. So the private sector, in many cases churches, in many cases small grassroots organizations stepped in and said, we need to do something, that there is need out there that the government is not covering, and so much more organized, much more institutionalized nonprofits started to emerge during the 1980s to respond to that need. And Marian Polk Food Share is a private nonprofit organization, so we are not a government program. We receive some small amounts of taxpayer funds through grants in particular. We get USDA commodity foods, which comes with some money, but it really represents around 7% or so of our revenue that we utilize to run our programs. The vast majority of how we run, and many food banks across the country, comes from private donations, from local communities, from just individuals like yourselves that decide this is important to us, we want to be a part of this. That's where our funding comes from. So we would not exist without this community and without the amazing support that we have coming from our local community here. So that model, leading to nonprofit organizations with big warehouses, with trucking systems, that all really didn't develop. It's only been around for a few decades. So one of the pioneers was St. Mary's Food Bank in Phoenix. They were one of the first to really get large and establish this kind of industry. So that's just a little bit of background on food banking and how it came to be what it is today. So then looking specifically here in Marian and Polk counties and in Oregon. So food insecurity is a big problem. It's a problem not only here, but in other parts of the country too. For a few years back, Oregon actually ranked third in the country for food insecurity. So we were one of the worst states in terms of food insecurity. I kind of am using that term food insecurity and hunger interchangeably. Hunger is a maybe more commonly used, less jargony. Food insecurity actually has a definition, which I'll get to in a second. But right now I'm just kind of using them interchangeably. So yeah, Oregon has moved down in that, but the kind of biggest pockets across the country, the South is Mississippi, Alabama, Georgia. That's generally the worst area, and then Oregon was kind of right up there too with many of those southern states. Now we're down a little bit lower, but Oregon sees a significant need for food. And so why is that? So that's another long conversation, but the thing that I would mention is hunger is a symptom of poverty. It's a part of need. It's a basic need. It has to do with whether people can afford to buy enough food on a consistent basis. Food insecurity in particular looks at whether people have consistent access to healthy food. So are you challenged with decisions like, gosh, this month, am I going to be able to pay rent or buy groceries? If you are if you're faced with that decision, then that would be considered food insecure. Or somebody that's in a state of hunger. Hunger in the United States, of course, is different than you might see hunger in third world countries where there is, say, starvation or famine. That's not necessarily the case in the United States. We have plenty of food all around us all the time. It's just a matter of whether people can afford it. So when we look at hunger in this country, it's more food insecurity, meaning you're faced with those tough decisions where, am I going to pay my medical bill or am I going to go buy groceries this week? That's food insecurity that we're looking at helping to address. So our goal is to at least make that food part easier so the rest of what people need to afford or what people need to do is more doable for them. Marian and Polk counties are right around, Marion County in particular is right around 15% of the population is considered food insecure. Polk County, it's a little bit less, so Polk County is a little better off in terms of need for food. And we're a little bit above the statewide average in Marion County, and I think Polk is a little bit below the statewide average. Let's see. Okay, so here's the definition of food insecurity. Low food security, at times unable to acquire adequate food for one or more household members because they have had insufficient money and other resources for food. Here's a percentage food insecure for Oregon. And of those, so SNAP is a part of this too. So I said food stamps before. Now now that program is called SNAP. So if you hear SNAP, it's Supplemental Nutrition Assistance Program, formerly known as food stamps. And so approximately 74% of people who are in our target that we're trying to serve are also eligible for SNAP. So many of the people that we serve also receive SNAP, and that's okay. We encourage that because the amount of food that we distribute just can't compare to the amount that is purchased through SNAP. So many of the folks we serve are utilizing SNAP through the earlier part of the month. When it runs down, the latter part of the month, food banks are much more heavily utilized when the food stamps run out. We also, though, have we do have an income guideline for who's eligible for our services, for our food boxes, which I'll get into with programs. But our guideline is a little bit higher than SNAP. So we have some people that maybe don't qualify for SNAP, but due to other expenses in their life, maybe health issues, hospital bills, maybe just really low income and employment, but still don't get enough SNAP, or really high housing costs. Housing is probably the largest challenge that people we serve face, that we hear about over and over again, is how expensive rent is or mortgage. So some people might make enough that they don't qualify for SNAP, but due to such high cost with housing or other things, they still qualify for our programs. And so that's kind of in this 25% of people that qualify for us but don't qualify for SNAP. I know you can't see it, but or the detail on it, but I thought I would just share. This is the kind of mapping and the kind of detail we look at around the community. So the darker areas are the more food insecure areas, and that's where we try to focus our services where there's higher need. Okay. Actually, before I jump into this, the other kinds of things around community needs I wanted to mention. We also see challenges to food access. So when I say food access, that's like somebody might be able to get or afford the food but can't get to it. So we have we serve a large urban area in Salem, but we also serve a lot of rural communities. So a couple examples that come to mind are Grand Ronde we serve Falls City, and we serve Mahama, we serve Idana. So some of these communities, there are not good public transportation systems. There are maybe not even a full grocery store that's easy to access. So if somebody's on a really limited budget, gas is, car maintenance, gas, are all tough things to afford. You might have a food access issue. So where people can't actually go and get food, or if they can, only thing that's available is a convenience store with really unhealthy options. So we also look at that piece. Not only can people afford food, but what's available in their community? Is there even a grocery store? Can you get to it reasonably? And so our services also try to fill some of those gaps. And then education is another one. We distribute a lot of fresh produce, and some people don't know what to do with that. Hopefully, apples is a pretty easy one, but other kinds of veggies, other fruits and vegetables, we have people that are less familiar with, with cooking, with meal planning. So we provide education along with our food. We provide cooking classes and gardening classes. We've even done some canning and food preservation classes. Again, that will come with the programs, but we see another community need just around education, how to use the food that you're offered. It can seem very affordable in the short term just to go get McDonald's. In the long term, there can be other problems with that. So we see a lot of connection actually between having diet-related illness and hunger, or food insecurity. So people that might be food insecure, the cheapest, easiest thing for them to get with their limited dollars is fast food. And that leads to all kinds of other health issues, of course. So we have a lot of folks we serve that suffer from diabetes or other diet-related illness. So we try to be heavy on produce and heavy on healthy food, and that needs to come with education many times because people are not familiar with how to use that. So that got me into programs already a little bit. So what are the programs we run? The most probably well-known are we support food pantries. So a food pantry is a location, a place across the 2 counties. We have about 50 food pantries that we support. And our model is, Marian Polke Food Share, our warehouse is a distribution center. So we receive food product from all kinds of different donors. And we distribute that to our pantries and our meal sites. I'll talk about meal sites next. So our location on 1660 Salem Industrial Drive is not generally a place where people come to receive food. It's a distribution center. So we receive donations in, and we deliver out to locations across the 2 counties. Some of the locations are part of larger nonprofits that you have probably heard of, like the Salvation Army in St. Vincent de Paul. Those are 2 of our largest food pantries we partner with. And then we work with a huge number of small organizations, many faith-based. Many are in churches or schools or community centers of various kinds that distribute this food out to the public and out to the community. So our food pantries are all open to the public. They have to be open to the public. They provide a range of all kinds of food similar to what you'd see at a grocery store. So you're going to see produce. You'd see shelf-stable food, you'd see dairy products, canned products, you'd see USDA commodities too. I mentioned USDA earlier, about 18% of the food we send out comes through the USDA. And in many cases, we have a model at our pantries over half now, where an individual could go in and actually shop the pantry like a grocery store. So it's a little different when you think of kind of your traditional food box where somebody comes in and gets a pre-made box. Now we're moving toward a model where somebody gets a shopping cart. There's limits usually posted on the racks, and some volunteers walk through with people, and people can actually choose what fits their dietary needs, what fits their family's eating habits, and choose foods off the shelf. And we'll even use grocery store marketing techniques to push the healthier foods through that process. So you hit produce first. At eye level are the most healthy items, and then at the very end are snacks and things like that after you've already got a full cart. So food pantries are really the primary way that we distribute food to the community, and it's aimed to be a 3 to 5 day supply of food that a family walks away with. That's a varying size depending on the number of people in their household. And the pantries are open anywhere from 5 days a week. The larger sites are Monday through Friday, to some are only open a couple times a month in, say, some much smaller rural communities that we open less frequently. There's the question of where all this food comes from. So again, I mentioned the generosity and the support of our financial donors to keep our doors open and keep the warehouse running and our trucks running. We also have a huge debt and gratitude to our food donors. So most of our food is privately donated from food industry partners across the 2 counties. Again, we get some USDA product. We get some donations that come from out of state through Oregon Food Bank, like California farmers will donate to Oregon, and that gets spread out through the state. But the majority of our food is local. So we're getting food from really all the large manufacturers and processors. That's probably our biggest category. We are really fortunate in our community to have partners like Norpac, like Truett, like Rain Sweet, companies that do a lot of frozen food and dried fruit products. There's not as much canning as there once was, but we occasionally still see some canned. But all that stuff, whenever there is overages or maybe label errors, or even in Norpac's case, they intentionally earmark product for us ahead of time through an amazing program called Farmers Ending Hunger. So sometimes there's even that intentionality of we're going to actually grow and package for you for the food bank because it's something those companies care about too. But in many cases, we're getting food that is just otherwise would not be able to be sold for various reasons. And then farmers are huge too. We have an amazing partner called Salem Harvest. They're another nonprofit that will go out and harvest vegetables and fruits from farmers where they, for various reasons, aren't going to harvest all of their crop for that year. So we have fresh product coming from them as well as other farmers that just deliver things directly to us. So, and then the last group of donors I have to mention is grocery stores. Essentially every grocery store, I think 47 grocery stores across the 2 counties are pulling all of their product as it gets close to sell by dates and use by dates, freezing the meat for us, holding aside dairy products, produce, anything that they can't sell, and we're going around and picking that up and distributing that through our food banks. So we've got food industry and manufacturers, processors, we have farmers, we have grocery stores. Really at every level of the food system, we have donors that are helping to keep our food supply full. So that's food pantries. In terms of just some numbers, for those that are numbers people, I mentioned we have it's specifically 48 food pantries across the 2 counties. Our food pantries as a whole are distributing about 9,000 food boxes per month. That's what, and those are again our 3 to 5 day supplies of food. In total, this includes meal sites, but in total in a given month, we're serving right around 40,000 individuals. And that represents about 1 in 5 people across the 2 counties throughout a year will receive some kind of service from us. So huge numbers of people. Now, there's a range in how often people access our services. Some are coming every single month. It's part of their monthly budget to get that food box. We also see individuals that maybe only come once a year, that maybe they just lost a job or just hit a major expense, something like that. So there's a range, but you know, 1 in 5 people across the 2 counties at some point in a year will utilize a service of Marian Polke Food Share. So we have a very large reach. So I briefly mentioned meals. So like I said, most of our food and most of our services go through food pantries, but community meals are a really special and important program too. So we have roughly 20 sites that are providing a hot meal. So instead of going to get a food box that you take home and prepare and eat at home with your family, you're eating in community with people on site. And some of these are really well-known sites like Union Gospel Mission and the Salvation Army Lodge, Northwest Human Services, Hope. Those are mostly serving individuals that are homeless. So a number of these are focused on serving the homeless community. But then others are really focused on serving the whole community. Anybody can come in and have a community meal. And so that would include, there's a site called First Christian Church in Silverton, Kaiser Community Meal in Kaiser, South Salem Friends at South Salem at the Quaker Church. So these are sites that get food from us and provide a hot meal to anybody that comes in their doors. And that includes some homeless people, but it also includes families, includes seniors. A whole range of people come to our community meals. And these are typically anywhere from twice a week to once a month, kind of the range that they serve. Most of them are serving once a week. Actually, before I jump to Meals on Wheels, the last piece of where our food goes is we also provide a lot of food to other nonprofit partners that provide other services. So for example, Family Building Blocks or Catholic Community Services or drug treatment programs. So we'll provide food to other programs that when people come in to say get services to help with childcare, and they can ask, do you also need food, and get a small food box. So some of our food also goes to other partners. Some medical clinics have our food available on hand. Meals on Wheels has now become really our second largest effort after our food distribution program. We've been doing Meals on Wheels for I think about 4 years now, and there was previously a Meals on Wheels program, and about 4 years ago we merged organizations. So we now run the service for Salem and Kaiser. We don't do Meals on Wheels in the rural areas at this point. There's another agency that does that. But for Salem and Kaiser, we are delivering around 400 hot meals every day to homebound or folks with various disabilities, really anything that's a barrier to getting out and cooking, shopping, and preparing your own foods. If anybody has those barriers, then they qualify for Meals on Wheels. That's the foundation of it. Anybody who, so really this is a program to help individuals stay in their home longer, to be independent longer, and to have good nutrition. We have we follow nutrition guidelines. They're really healthy meals cooked from scratch in our kitchen, as well as a program that provides a wellness check and some socialization for folks. We serve quite a few people who are pretty socially isolated, maybe don't have family in the area, so their interaction with their driver or talking to our staff on the phone, in some cases, is one of the few connections they have. So it's an amazing program, and we've come to see it as incredibly important, just as important as our food distribution programs. Like I mentioned, about 400 home delivered meals a day. It's all delivered by volunteers. We have an amazing group of about 100 volunteer drivers who deliver this food every single day, or five days a week. And then we also run 2 meal sites that are specifically for seniors. One at Center 50 Plus on Portland Road, and then another one at the South Salem Senior Center in South, right out before you get to the freeway going out south. So we run both of those meal sites and provide the hot meal there. So our 2 biggest programs for getting food to people in the immediate term is that food distribution program and then the Meals on Wheels program. Then we have a number of other programs that are focused on the food system, that are focused on building communities, still with food at the center. One of those is our community garden program. So we support a network of right around 60 community gardens across the 2 counties. We focus those to serve lower income neighborhoods. And right around 750 people participate in this program where they rent a garden plot, they learn to grow their own food, and they get to take home that harvest for their family. And we provide educational classes, we provide the soil and the plants and the compost, that kind of stuff. And so it's a really fun program, and for some families it makes a really big difference, especially if they can connect that with the food preservation piece and saving that harvest throughout the year. And some people do winter gardening too. So community gardens we've been doing for, gosh, over 10 years now. We've been doing community gardens at the food share. This is a bit of a newer program that grew out of the community garden program. It's called the Youth Farm. And we run a 7-acre farm that is on the campus of Chemeketa Community College. It's out kind of behind the softball fields. If anybody's welcome to come and check it out. And we grow produce there, and youth grow, well, specifically youth grow produce there. High school aged youth come there for a summer program. They learn some basic job skills. They do some leadership development kinds of activities. And they grow food for the food bank and for some other programs that we run. Much of the food they grow is distributed through a medical clinic partnership called FarmShare RX. So they bring their food over to a clinic and distribute that food to patients that were identified as needing some additional fruits and vegetables in their diet. So that's the big way that produce gets used, but then about half of it comes through our normal food pantry programs as well. So that's been going on for about 3-4 years now, our youth farm program. Before I get to this, the other piece of what we do I wanted to mention, which is part of the youth farm as part of this, is work experience. We've looked across our organization, and as we think about kind of all the different factors that lead to hunger and poverty, we've also thought about job training. What can we do to help people build skills to find employment and support themselves? So the youth farm is a part of that for younger adults, but for adults, really we've got about 20-25 positions across the organization where we have receptionists, we have warehouse work, all kinds of positions where people are coming in to do job training with us through a program with DHS. So they do 6 months to a year training and then move on to other employment. So we're also a training center for a number of people to get work experience. Okay, I think that's the quick version of our programs. Next I'll talk about kind of some of the trends in food banking, how things have changed over the years, and what are we thinking about for the future. So, like I mentioned before, the drive of food banking has been to get food to people now, to help with that immediate dietary need that people have for nutrition. And as food banks have grown and gotten more sophisticated and built up their bases in the community, gained more and more support, there's thinking of, well, what more can we do to try to cut down on the need to begin with? What's our role in what sort of gets dubbed the root causes of hunger? How can we help address why people are in this state of needing food to begin with? So some of how things have changed is that's become part of our lingo, it's become part of our programs, it's become just ingrained in our thinking. There's, Oregon Food Bank uses food today, food tomorrow. So how do we help make sure people have food down the road with or without our services? And so I mentioned some of the education. That's been one of the big changes, is providing education along with food. When I talked about community meals, I mentioned maybe I didn't quite mention it, but the really neat thing about community meals is that what happens around community building in that space, that you're getting people from across different walks of life getting to know each other, having conversations, and maybe developing their own informal ways of supporting one another. So what would a community look like if everybody knew their neighbors and cared about their neighbors the same way, maybe that they, in a deeper way that maybe that they do? Could people be helping out one another more in an informal neighborhood level to where these big services aren't as necessary. So we see meal sites as well as other programs as a way to try to build relationships and build community within neighborhoods to get people together talking and knowing one another. So one way it's changed is community building has become part of what we look at trying to do. How do we bring people together? So education, community building, those are some of the changes. Another one is how are we involved in issues of advocacy, issues of public policy, and in some ways issues of justice or issues of employment issues, that sort of thing. So whole range of things that they get much more complicated and can be much more controversial, I guess, than saying we're here to get food to people. And that is our core mission, and we don't see that changing. Our mission is to get food to people now. But food banks have thought about, are there certain pieces of policy or certain that would make sense for a food bank to get involved in? For example, our network in Portland, our Oregon Food Bank network, has been involved in advocating for SNAP. So food stamps. So if we see that there are cuts coming down the line to make food stamps not as available, that organization in Portland has said, as a food bank, we don't want that to happen because we know that we can't make up for all that. We're going to see more people coming through our system if that gets cut, and we can't handle that kind of volume. So we have gotten involved historically in advocacy around SNAP, but this is another area of growth for us and another area to navigate very carefully and think about when is it appropriate for excuse me, a community-based nonprofit to get more involved in politics or in advocacy. So when I think about what are the changing things going on in food banking, it's grappling with the idea of how we may or may not want to be involved in policy issues. It's getting more involved in education, which we've been doing, providing education along with the food. One I didn't mention yet is unique partnerships. So going to places where people already are, so you don't have to go and find a food bank. You find the food in a place that you're already going. So where we've found this to be most successful so far is I mentioned partnerships with medical clinics. We have a relationship developing with Salem Hospital, with Lancaster Family Medicine, a huge clinic out on Lancaster. To distribute food to people, where are those that are most in need of the food and maybe also have health issues already going? Can we distribute food through those sites? School pantries are another big one. Instead of having to go find a little location within a neighborhood, you get your food when you go pick up your kids from school. So it's available at the school. There's a food pantry right there. So those are all some of the other emerging trends, I would say, is making the access piece easier for people. Trying to help eliminate that transportation barrier as much as we can. This is an image I took from an Oregon food bank. Just thinking about the different ways that these sort of emerging trends are being talked about. So food access is the core of what we do, provide access to food. Food literacy is that educational piece. How do you use the food? And then this other piece I haven't mentioned much yet, which is community-generated solutions. This is about wanting to involve the people that we're serving in designing how we serve and how our programs operate. We've done this, a lighter touch of doing this is like doing surveys and getting feedback and that sort of thing. And then deeper is to what extent are the people we're serving actually running our food banks? In many cases, they do. There's a lot of crossover. There are many people, when they come in and get a food box, they want to volunteer, they want to give back, they want to feel like they're not just getting a handout, that they're doing something. So we have many people that come in and they want to volunteer. So how do we encourage that and help people develop into leaders of their own neighborhoods through the food bank? So community-generated solutions is another kind of emerging trend, and how do we involve the communities and involve the individuals that we serve in our work? We think that the work will be more effective, more relevant, and more meaningful if those we're serving are actually involved in helping us figure out the best way to provide that service, especially when it comes to helping people get out of that state where maybe they don't need the food bank anymore. We need to know from them, what are the barriers, what are your needs to get there. This is just some explanation of some of those same concepts I just talked about. Familiarity and convenience, going where people already are, schools, sites like that. Social capital is that meal site, concept of how do we bring people together and build those social networks, and then community-led solutions. Okay, I'm going to go quick here because I think we want to have time for questions. So I do want to have time for questions. So so where are we going? So I kind of said that this is where food banking is going and what we're grappling with. And then how about the Marian Polke Food Share in particular? So these are parts of just kind of the broad headers of our new strategic plan that we just completed. Thinking about where we've been, where food banking has been over the last several decades, and where some of those emerging directions are. Where do we want to fit into that? So food access is of course central. That's what we're here to do. That's our mission, is to provide that food. And within that, we're trying to focus on underserved communities. So looking across our 2 counties, thinking about that map you saw, where are those areas where those high need, those dark reds, but maybe our distribution's not as heavy. We can overlay that kind of map with a map showing where does our food go. And so is our food getting to the areas and getting to the people that it needs to get to? And one of the specific projects under this category would be a mobile pantry distribution. That is something people have done across the country. But could we have our own food pantry that is on wheels, where we can take it right to a particular neighborhood or to a particular rural community that doesn't have a pantry currently? So developing things like mobile pantries to serve underserved communities. We want to have strong partner agencies. I mentioned, those groups, the amazing groups of volunteers and of people that are distributing food in food pantries. And we want at least some of those sites to be sort of this elevated level of food pantry that's going to have the food you need, but it's also going to have job resources. It's also going to have educational resources. It's also going to have ways for people to do that community building work. It's going to have the push the healthier food, the most healthy food possible. So we're developing a kind of network within our network of those most robust and strongest pantries that are really there to do more than just give out the food. They're there to help lift people up, help find other resources, and be part of those longer term solutions. How do we do intentional resourcing? This is around our food. So this is basically how do we make sure we're getting the right food and getting the healthiest food that we can into our system. Partnerships with the health sector, I mentioned this a few times already. We want to invest heavily in working with the hospital, with clinics. Food hunger itself is a medical issue in some ways too. A lot of health problems are connected with lack of access to food. Focus on older adults. We continue to see higher rates of hunger and food insecurity in our community for seniors. And our Meals on Wheels program, it has been growing immensely, but still has room to grow. So we want to continue to focus on that program, as well as other programs that focus on serving older adults. And then continuing to support SNAP and other kinds of support systems that really round out the picture of how to help keep people food secure. And there's a few more. I mentioned community-led solutions involving the people that we serve. I mentioned advocacy already. This cross-sector, this is how, like in Salem, are we working with the groups working on housing? How are we working with the groups working on access to medical care? We're all serving, in many cases, the same people. So this is us, wanting to get out of our nonprofit silo of food and getting others out of their nonprofit silo of whatever it is, addiction treatment, whatever piece of service you want to look at. So trying to collaborate more across nonprofit sectors and government and business sectors. So more cross-sector collaboration. And then a focus on diversity. We think that as our community is continuing to get more diverse, in some areas we're serving primarily Latino community members. We also serve a lot of Russian community members, Pacific Islanders. So what can we do as an organization to be more understanding and responsive to the needs of different cultures? Are we ensuring that all of our material is in multiple languages, or has pictures, or is accessible and welcoming to people of all backgrounds? That's another focus area for us. Okay. Sorry I didn't quite leave as much time as I was hoping, but I would love to have some discussion and hear some questions about what we do at Marian Polke Food Share. Yes, sir. Yeah. Oh, thank you.
Am I?
Oh.
Hi, this is Anne.
Oh.
And what I wanted to know is, do the federal government food commodity programs have restrictions regarding advocacy?
In terms of what we can do as an organization, is that like, no, not from the USDA. I mean, as a nonprofit, as a 501c3, there are limits to what you can and can't do. You can't, for example, get involved with supporting political candidates, which we wouldn't want to do anyway. But you can't do that. And then in terms of your overall getting involved in advocacy, policy issues, there's sort of a percentage of your budget that it can't be over. And the vast majority of what we do is and will continue to be food distribution. So it's really a pretty small piece. But there are some limits to what you can do as a 501c3, but we're not anywhere near those currently. Yeah.
Hi, this is Gwen Ellen, right down here. Hi.
Oh, yes. Hi.
I was at in reference to the change of food banking these days, I was at a benefit concert for, I think it was Catholic Social Services. Mm-hmm. So they may distribute things differently, but they were encouraging us to look at foods that could be eaten because so many people are living out of their cars now and they don't have refrigerators or stoves or anything like that. Are you finding that, or is that a part of what you're doing also?
Yeah, absolutely. So we do set aside certain products that we know are good for those without an access to a kitchen, essentially, maybe living in a car or camping or whatever that is. And many of our food pantries do keep those set aside for people with that need. And on intake, when somebody comes in, they ask address or if somebody is homeless, and so we can adjust what kind of food they're getting to that need. Yeah, we do that. Mm-hmm. We can always use more of it, but I wouldn't say it's the top thing that we need in terms of food donations. Many of our food drives lately, where people are giving food that they're purchasing or whatever, we really want to focus on shelf-stable protein. It's probably our top need. So that would be peanut butter, canned tuna, or other canned meats. We can definitely use but pop-top cans are always better. We don't have to have a can opener with any of those kind of things. So we definitely have that need, but typically when we say like what's our top need for a food drive, it's more of those proteins. But yeah. Yes, sir.
Yes, my name is Stephen, and I have a question. Do you find that the more services you provide, that it draws more people to Salem? Because let me explain what I mean. I noticed that some people are quite good at navigating the system, and if they're aware that the word gets around. I mean, there is a network in poor people that's fairly sophisticated. I had an assignment one time in a class of social work, and what we were supposed to do is pretend like we were poor, which wasn't hard to do actually, because I was a student. But we dressed like we were poor and so forth, and then we were to go out into the community and somehow survive. You know, that was one of the assignments for the class. And it was amazing to me how what you could come up with. Just, I mean, most of it was kind of off the grid, but the people that I talked to, a lot of them knew where to go and what was available and what to do and what not to do, and it was interesting to me. Now, one thing, the question I have is the first one that I mentioned. I'm not supposed to ask two, but I'm going to ask it really quick. Is that why isn't there more exchange? What I mean is, even poor people can be really resourceful. Why is it that there isn't some sort of token or something can be given that if you do a certain amount of work, you know, things, because food is quite a big incentive for people.
So I think the first question was whether this, like, as we grow, are we attracting more people to the community? Is that kind of was the first question? I mean, anecdotally, I've not seen that. I mean, I don't know. You know, I think there could. You'd have to maybe look at population trends over time and whether people are moving here. I mean, many times when people have from what I see, people have pretty limited resources. Moving is a difficult thing itself. But then other times people are very transient. So, you know, we have people that we serve that move really frequently due to, you know, where they can find temporary housing or employment. But to answer the question directly, I've not seen that in particular where we hear that people are moving here for services. I have heard, for example, that in Portland, there's some trend of from other cities, people actually giving homeless people bus tickets to get there. Again, they deny that happening, but you know, but again, that's anecdotes. So I have no actual data or real evidence to say that happens. Yeah. Oh yeah. Okay. I can at least relay the comment was that we've seen an increase in homelessness, which absolutely we've seen that. And then and then the second question was around, can you remind me of the second question, Ms. Smee? No, move on? Okay. I'm happy to answer it, but I'm getting the signals to move to the next question. Okay.
Hi, this is Lester.
Okay.
One of the issues strikes me is that when I see an employment of 50 people and all the other things that go into this, getting food, say, from a farmer and so forth, doesn't do there. Are you having a cash donation issue of terms of actually having money to support the operation?
Yeah, that's a great question. Of course, we always need funds to just continue to operate, and that's always a huge amount of work and a huge amount of generosity needed to just keep the normal operation going. And then as we talk about wanting to grow or wanting to address more needs and try to get to deeper and better solutions, that all can cost more too, to have that staff and that whatever resources that takes. So, you know, we always have that need for donations every year just to do what we do all the time. In terms of how we are, you know, overall as an organization, we tend to be pretty healthy in terms of, like, you know, we are not a nonprofit that is operating in the red, and we are not, you know, doing more than we can, like biting off more than we can chew and having to scale back. So we have been generally on a growth trend in terms of our financial health. But we always have to have the generosity of people to keep that happening. And so we're kind of always at that, on the whim of the community to want to keep supporting us. So.
Ian,
Yeah.
this is Tom. First, thanks for a very thorough and fascinating presentation of what you people are up to.
Oh, there you are. Yes,
Yeah, here.
okay. Sorry.
My question is, you mentioned trends and you mentioned strategic initiatives, and I'm wondering whether there are procedures through which you're sharing these ideas with others, or whether they're sharing them with you. Are there conventions? Are there newsletters? Are there journals? That sort of thing.
Yeah, so we have a network of food banks again in the state as well. Do you mean sharing amongst kind of our peers? Okay, yeah. So yeah, the biggest way we do that is through, we have quarterly conferences with all of our food banks across Oregon where we talk about and share this kind of information, what's happening in Coos Bay, what's happening in Beaverton, whatever it is. And then we also sometimes participate in national conferences, conversations. Sometimes there are, a lot of webinars and phone calls that happen, and then there's also in-person national conferences on different food banking topics. So we'll go and sometimes participate in those. So there is a whole kind of forum out there for those doing similar work across the country to communicate. So, yeah.
This is
Yes.
Barbara.
Hi.
I want to say that my son volunteers at a pantry in Vancouver, Washington, and it's a wonderful thing. And I don't believe that people come anywhere just because there's food to be had. I would love to have had that when my first husband and I were raising children while he was going to college. So it's a wonderful thing that you're doing. Thank you so much.
This is Cassia. Do you or your organization do any field gleaning for food resources?
Yeah, earlier I mentioned the group called Salem Harvests, and they've really kind of cornered that activity, and they're amazing in our community, and they are pretty similar to a gleaning group. So they're a group of volunteers that go out and will harvest crops that are not going to get harvested otherwise. So we don't do that directly with our staff or our volunteers, but another organization does, and they donate most of what they pick to us. So yeah, you can look up Salem Harvest, and anybody can come become a volunteer with them and go out and do a pick at an apple orchard or whatever it is. So yeah, they're great.
All right, I think we've run out of time. It's 11:30.
I'm not going to let you go without without giving just a wonderful thank you for stepping in and educating us. I dare say everybody in this room had no idea what all the things you're doing. Thank you.